So, good morning, everyone. So, we are Group 2 and we are going to be talking about food poisoning. So, first, what are the things that you have to know about food poisoning? So, food poisoning is an illness caused by eating contaminated food. It's not usually serious, and most people get better within a few days without treatment. But it can also cause serious long term problems like kidney failure. Occasionally, people die from food poisoning. In most cases of food poisoning, the food is contaminated by bacteria such as Salmonella or Escherichia coli or E. coli, a parasite, or a virus such as the norovirus. And the most common types are Campylobacter enteritis, cholera, E. coli enteritis, fish poisoning, and etc. So, as you can see there, here is a concept map about the whole concept of food poisoning, where it involves a process, symptoms, causes, intervention, prevention, when to see a doctor, and nursing management. So we're gonna dig deep into each one of them. First is the process. So what happens in the body, or the process that happens in your body? So first, the bacteria enters. Some bacteria or enterotoxins can survive harsh stomach conditions, making their way to the gut. There, the misery begins, sometimes up to 72 hours after eating the offending meal. Then, second, the bacteria multiply. Undetected by the body's immune system, the bacteria quietly multiply, producing toxins. These invade and penetrate the gut lining, setting off a strong immune response. Then, immune response, where immune cells release signaling proteins called pro-inflammatory cytokines, which set in motion a series of steps, causing gut inflammation and swelling, leading to discomfort. Fourth, flooded intestines. The intestinal wall is designed to absorb nutrients and water from food. Bacterial toxins can cause pores to open in the wall, allowing water and other molecules to flood in. And then you experience diarrhea and dehydration, where the excess fluid and electrolytes in the gut lead to watery diarrhea, which has a beneficial role of flushing out the bacteria and their toxins. It can, however, cause dehydration. And last, vomiting. Some bacteria don't cause vomiting, but Staphylococcus aureus enterotoxins do. Research suggests that they may stimulate the vagus nerve, which transmits a signal to the brain's vomiting center. And we're going to be talking about next is the symptoms. Food poisoning symptoms may vary with source of contamination. The length of time it takes for symptoms to appear also depends on the source of infection. Here are signs one must consider: nausea, vomiting, watery or bloody diarrhea, abdominal pain or cramps, and fever. Now, to what are the causes of food poisoning? So the first cause is bacteria. Bacteria is by far the most prevalent cause of food poisoning. E. coli, Listeria, and Salmonella are some dangerous bacteria involved in food poisoning. Second are viruses. Food poisoning can also be caused by a virus. The norovirus, also known as the Norwalk virus, causes over 19 million cases of food poisoning each year, which in some cases can be fatal. Sapovirus, rotavirus, and astrovirus bring on similar symptoms, but they're less common. Parasites. Food poisoning caused by parasites is not as common as food poisoning caused by bacteria, but parasites spread through food are still very dangerous. Toxoplasmides, the parasite seen most often in cases of food poisoning. Fourth, chemicals. Harmful chemicals may be present in certain foods including fish and shellfish that contains toxins produced by algae or bacteria, certain types of wild mushrooms, and unwashed produce that contains large amounts of chemical pesticides. And lastly, when the food becomes contaminated during production, processing, or cooking. Not cooking thoroughly the food, improper food storage, and refrigerated after a long period of time, eating food after being touched by someone who is ill, and cross-contamination.
When to see a doctor. See your doctor or healthcare provider if you have symptoms that are severe, including bloody stools, high fever, frequent vomiting that prevents keeping liquids down, which can lead to dehydration, signs of dehydration, including little or no urination, a very dry mouth and throat, or feeling dizzy when standing up, diarrhea that lasts more than 3 days. Interventions. Hydrate. Until you feel better, you should rest and drink fluids to prevent dehydration. Try to drink plenty of water, even if you can only sip it. Ease slowly back to eating. Eat when you feel up to it, but try small, light meals at first and stick to blunt foods such as toast, crackers, bananas, and rice until you begin to feel better. Oral rehydration solutions, or ORS. Oral rehydration therapy is a type of fluid replacement used to prevent and treat dehydration, especially that due to diarrhea. It involves drinking water with modest amounts of sugar and salts, specifically sodium and potassium. Probiotics. Probiotics are live bacteria and yeasts that are good for you, especially for your digestive system. Prevention. The best way to avoid getting food poisoning is to ensure you maintain high standards of personal and food hygiene when storing, handling, and preparing food. The Food Standards Scotland, or FSS, recommends remembering the 4 Cs: cleaning, cooking, chilling, cross-contamination. Preventing the spread of infection. If you have food poisoning, you shouldn't prepare food for other people and you should try to keep contact with vulnerable people, such as the elderly or very young, to a minimum. Stay off work or school until at least 48 hours after the last episode of your diarrhea. If someone you live with has food poisoning, you should make sure everyone in your household, including yourself, washes their hands with soap and warm water regularly, particularly after going to the toilet and before and after preparing food. Clean surfaces, toilet seats, flush handles, basins, and taps frequently. Make sure everyone has their own towels and flannels. Wash the laundry of the infected person on the hottest washing machine setting. Nursing management. Nursing plan for food poisoned clients. Monitor the patient's fluid status carefully. Plan care to allow uninterrupted rest periods for the patient. If the patient is nauseated, advise him or her to avoid quick movements, which can increase the severity of nausea. If the patient can tolerate oral fluids, replace lost fluids and electrolytes with broth, ginger, ali, and lemonade as tolerated. Assess vital signs at least every 4 hours. Weigh the patient daily and record intake and output. Teach the patient about food poisoning, describing its symptoms and varied causes. Teach the patient the proper preventive measures. If dehydration occurs, administer oral and IV fluids as ordered. To ease anal irritation caused by diarrhea, clean the area carefully and apply repellent cream such as petroleum jelly. Wash hands thoroughly after giving care to avoid spreading of infection, and use standard precaution whenever handling vomitus or stools. That would be all. Thank you for listening.